Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, doctor. Let's start with the basics. What exactly is a seizure and how does it affect the brain?
Seizure is one neurological disorder. In brain, everything is happening as an electric current. Like in our neurons, which are brain cells, in that electric current is passing, and that is communicating with our nerves and muscles. So, at the time of seizure, there is uncontrolled and unsynchronized electrical discharges from the neurons, and that will lead to motor or sensory or psychic effects on the body, and that are called seizures.
What is epilepsy?
Okay, uh, when there is two or more unprovoked seizures, that is called epilepsy. Epilepsy is a syndromic name that if patient is having recurrent seizure, in simple terms we can say that if patient is having repeated seizures, that is known as epilepsy.
What are the different types of seizures and do they affect people differently?
Yes, there are many types of seizures, but in general we classify seizures into two parts. First is generalized seizures. Generalized seizures means they affect whole of the body, and second is focal seizures. Focal seizures affect only a part of body, not whole body. So if we again deep dive into that, first part, generalized seizures are further classified into different types. Of them, most common is generalized tonic-clonic seizures. Generalized tonic-clonic seizures are in which all four limbs are involved, and patients all four limbs are tight. They are tightening of limbs with uprolling of eyeballs, with closing from mouth, with tongue bite, with or without involuntary passage of urine and stool. That is typical generalized tonic-clonic seizure. Other than that, there are many types like myoclonic seizure. In that, only jerking of body is there. Then atonic seizure, in which patient loses the postural tone and falls down. Then absence seizure. In absence seizure, just patient pauses for few seconds. That is absence seizure. So these are generalized seizures. Then we have second part, that is focal seizures. In focal seizures, there is part of body is affected. If patient is conscious during that episode, then it is called focal seizure without these cognitive features. And if patient became unconscious during that part, that during affection of one part of body, that is called focal seizure with these cognitive features. So these are some types of seizures.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
Yes, there are many causes for epilepsy. Common causes for epilepsy are, first is genetic epilepsy. If patient is having any family history of epilepsy, if any genetic mutations are there, then that will lead to genetic epilepsy. Second is symptomatic epilepsy. If patient is having any lesion in the brain, like any infective lesions, like tuberculosis, infective lesions in brain, then any tumor in the brain. If patient is having stroke, if patient is having trauma to the brain, if patient is taking any substance like alcohol, drugs, that may lead to seizures. If patient's electrolyte are imbalanced like low sodium, low calcium, low magnesium, high calcium, that can also lead to seizures. These are some common causes for epilepsy.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
Okay. Generally, patient is having single or at the most two types of seizures together. Like common type is juvenile myoclonic epilepsy, in which patient is having myoclonic epilepsy plus generalized tonic-clonic seizures. This is common combination where patient will get some jerky movements of the body, and that is myoclonic seizure, and as I have described, that is generalized tonic-clonic seizure along with that, which is infrequent. So patients, caregiver should look out for any seizure that is happening to the patient, any unexplained loss of consciousness to the patient, he or she should look for. And there is a very important thing that patient or relative should note down that how many seizures are there in a month. So doctor can decide on treatment, that which drug to be added, if drugs to be dose, drug need to be increased in dose, or what to do. So that is called seizure diary. That patient's relative should take care that how many seizures, which type of seizure, and for how long that seizure lasted. If that seizure happened in daytime or in sleep. This all should be noted down in epilepsy diary.
Now, let's talk about something that many people with epilepsy face: stigma. Can you
In
tell
our
us
country,
why epilepsy is
even today,
often misunderstood?
epilepsy is considered as Devi ka prakop or Bhut ka vas, like that. That in villages and in backward areas, many patients come after so many years of delay or months of delay. They will not contact directly to the doctor because they consider that this is some result of some bad karma,
Yeah.
or due to some bad soul attached to that person. So there is lack of scientific knowledge to them. So they will waste precious years of treatment, and patients, social as well as economical as well as educational uh, aspects suffer due to that.
Yeah.
And they hide this thing that patient is having epilepsy. If patient is having diabetes or hypertension or any disease like common cold, they are
Yeah.
not going to hide. But if patient is having epilepsy, they will hide that no, 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 patient, our relative is not having seizure, because they consider that epilepsy is a stigmata. Epilepsy is some may consider it as a curse, that we are cursed by the God that patient is getting these epileptic episodes. So there
Yeah.
is major awareness is lacking in this part, that we have to educate patients, means general population, that epilepsy is treatable if it is recognized early,
Yeah.
and there is no need to hide that patient is having epilepsy. In many patients, we promote that patient should carry one epilepsy card with him or her, so
Yeah.
that if patient is alone, any standby person can identify that patient is having epilepsy, is known case, and these are the emergency measures I have to take when
Yeah.
he is having seizure.
How does this stigma affect people with epilepsy?
Yes. Due to this stigma, as I have told, it affects all spheres of life. Like consider one 10-year-old boy who
Yeah.
gets frequent seizures. So parents will not send him or her to the school. So his educational aspect will suffer a lot.
Yeah.
They will consider that if patient is getting seizures, and if she or he get seizure in the school, everyone will know that patient is getting seizure. So they will not send child to school. Second thing, social stigmata is major when there is a time of marriage.
Mm-hmm.
They will they will hide this epilepsy thing. Second thing, if they will know that the patient is epileptic,
Yeah.
he gets frequent seizures. There is a problem in marriage also.
Okay.
Very less knowledgeable person will not ready for marriage thing also, because they are
Yeah.
not knowing that this is controllable thing. This is
Mm-hmm.
not curable thing in many cases.
Yeah.
Then third is work. On work also, many person will not be happy to work with that epileptic patient, or they will not hire an epileptic person as their worker or laborer. So that is also the reason that persons are hiding that he or she is having epilepsy.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Yes, very important question. There are some triggers, like if patient is having sleep deprivation, any fast like food deprivation, constant use of gadgets, that will lead
Yeah.
that are common triggers. So patients should avoid these triggers. And apart from this, any activity during which if patient gets seizure that may harm the patient or injure the patient, that all activities should be avoided by patient. Some of these activities are like driving. If patient is having epilepsy, he or she should not drive. Second, cooking. Patient may get burns if she is having seizures during cooking. Then
Hmm.
third is any adventurous sports,
Yeah.
swimming, that is to be, or machine work. Like if patient is a laborer and he is working on the machines, if he
Mm-hmm.
gets seizures, there may be injury to the limbs.
Yeah.
So these all activities are to be avoided by patient if he is having seizures.
Thank you so much, doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Yes, that is the most important part of our today's talk. I think
Mm-hmm.
I tell my patients, all patients and their
Yeah.
relatives, that during seizure the most important thing is to do nothing.
Yeah.
If patient is getting seizures, don't close the eyes, don't forcefully hold the limbs,
Mm-hmm.
don't put something in the mouth, because they feel like if patient is clenching the teeth, he
Mm-hmm.
or she might get injury to the lips or tongue. So they introduce fingers or spoon or anything or a handkerchief in the mouth. But
Yeah.
that will cause much damage to the patient. So that is not needed at all. If a patient is having uprolling of eyeball during the seizure episode, so they will forcefully close patient's eye. That is also not needed, because we have to understand that seizures are uncontrolled electrical discharges in the brain. We cannot stop that discharges in the brain cells by just holding the limbs or by just closing the eyes. So
Yeah.
externally, even if we hold the limbs, that may lead to muscle rupture. So there is no need to hold the patient. Just lie down the patient on the ground. Be sure that there is nothing in patient's surrounding that may injure the patient, like any sharp objects. And if
Mm-hmm.
patient is having vomiting after seizures or during seizure, then just turn the head to the side. So any vomiters is there, that will be out. And if seizures
Definitely.
last for more than 5 minutes, then take patient to the hospital, because most of the seizure, more than 90% of seizure will subside by its own within 2 minutes.
Yeah.
So that is very much important thing, that do not panic if patient is having seizure. Just be by the side of the patient and do nothing. Don't be overexcited and do things that may harm the patient.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
Final notes are this, that be sure and be aware of epilepsy, and don't hesitate to consult doctor if any seizure episodes in your surroundings.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.